Hello, I'm Dr. Jason Sims, and I'd like to thank you for choosing the Higher Care Clinic, THC2. The Higher Care Clinic was the first medical cannabis business to open in the state of Oklahoma back in 2018, shortly after the passage of State Question 788. And we continue to be one of the only comprehensive cannabis clinics in the country. How does cannabis work? Cannabis works by means of our endocannabinoid system. Now, all animals have an endocannabinoid system. It's the largest receptor system in our body, and it interacts with almost all of our bodily systems, and therefore interacting with multiple different disease states. And that's why the use of cannabis has treatment effects for all those multiple different diseases and ailments that we may have. The most abundant phytocannabinoids in cannabis are THC and CBD. THC is a psychoactive component of cannabis. Really helps with pain, really helps with appetite stimulation, sleep, those type of things. CBD has no psychoactive components, and CBD really helps to decrease inflammation, really helps decrease anxiety, really helps decrease depression as well. THC and CBD work so much better together than they do apart. Now CBD, along with THC, CBD keeps THC in check so that it doesn't cause those highs. It helps to decrease some of those side effects that the THC might actually cause. And when using cannabis, it's always best to err on the side of CBD. In the cannabis plant, CBD and THC always have to balance. So when one's high, the other's low, and vice versa. And all the studies that we've seen, and all the studies that have shown that around that 1-to-1 CBD to THC ratio is about the most beneficial for pain, for inflammation, for muscle spasms, for anxiety, for depression, for multiple different things. Now, there are also hundreds of other cannabinoids found in the cannabis plant, each one having their own medical value. For example, CBN really helps with anxiety, really helps with sleep. CBG, it's anti-inflammatory and possibly anti-cancer, really helps with those treatments. THCA, it's non-psychoactive. THCA actually becomes delta-9 THC when it's heated, but THCA itself is non-psychoactive, but it's really highly anti-inflammatory. And then there's THCV. THCV is actually an appetite suppressant, so it actually helps people to lose weight. Then there's the terpenes. The terpenes are the essential oils of cannabis. They give cannabis its smells and tastes. And there are hundreds of different terpenes that are found in cannabis, and many of those, of course, have medicinal effects as well. Then when you get those all together, the terpenes along with the cannabinoids, you get what's called an entourage effect, because they all work so much better together than they do apart. Then with cannabis also, you can also have what's called a carryover effect. And that's because whenever cannabis works with your endocannabinoid system, it helps bring your own endocannabinoid system back into balance. And when it does that, it helps everything work better. And the longer you can keep that balance, the longer the carryover effect you can have with the decreased pain, decreased anxiety, those type of things. Now, all those crazy names for all the different strains, or what we call cultivars, basically fall under three different general categories. You have the sativas, the indicas, and the hybrids. So the sativa is more of a head type feeling. It revs you up, it gives you energy. Now you have to be careful though sometimes, because some of them at higher doses can cause some anxiety. Now the indicas, indicouch, okay? It's a way to remember it because it's more of a body type feeling. Puts you to sleep most of the time, really helps calm everything down. And then those hybrids, those 50-50s kind of keep you on even keel. And then they can go to either side or the other, a little to the sativa side to rev you up, or a little to the indica side to calm you down. And not all of this, of course, is exact. You know, it can act different in different people, and can act different depending on also the terpenes that are expressed in those different strains as well. So why do we use cannabis? Cannabis can be used as a treatment for multiple disorders: chronic pain, arthritis, anxiety, depression, insomnia, PTSD, multiple sclerosis, Parkinson's disease, psoriasis, migraine headaches, autism, cerebral palsy, different neuropathies, sciatica, Tourette's, acid reflux, Crohn's disease, anorexia, and has even been shown to have some use in cancer as well. Many people are using cannabis or are turning to cannabis because the medications they take for pain or anxiety or insomnia just have too many side effects, or they're actually causing harm to their organs, or the medications just aren't working anymore. Take Tylenol. Tylenol is one of the safest medications on the planet. but in high doses can cause cirrhosis of your liver. I've had people actually die from overdoses of Tylenol. Ibuprofen works really well for headaches. It's an anti-inflammatory, but can also eat a hole in your stomach, cause kidney problems as well. So much so that I have patients that are on dialysis from using too much ibuprofen. Then we have opioids. Opioids used for pain. They've been used for pain for a long time, but they don't work that well. They control you because they're so addictive. They cause horrible constipation, and they can also cause brain fog. So when using cannabis for pain, it generally doesn't take away your pain, but it does put it to the back of your mind, so you're not thinking about it as much. But cannabis is also a powerful anti-inflammatory. It's about 20 times more anti-inflammatory than aspirin, 8 times more anti-inflammatory than ibuprofen, and twice as the anti-inflammatory effect of cortisone. Now, most medicines that we take now for anti-inflammatory actually modulate our immune system. It decreases it, keeps our body from attacking itself where the inflammation's at. However, cannabis decreases inflammation at the cellular level. So we actually can increase our immune system because of the way it's working. So what are the side effects of cannabis? As with all medications, cannabis does have some side effects. Some good, some bad. Now, most side effects with cannabis are usually dose dependent. But if you do start having some undesirable side effects, the way to help to relieve that is to either decrease your dose, you can change the strain or the cultivar that you're using, or you can add more CBD. So how do we use cannabis? So when using cannabis, each person needs to figure out which way works best for them and which way gives them their best results. Now, because we are all so different, each of us will prefer different ways to use cannabis and in different amounts. And this is based on our own endocannabinoid system and how cannabis interacts with that system. And it has nothing to do with age or weight, sex, size, or ethnicity. Now, you can develop a tolerance to cannabis, but you can also reset that tolerance. And you can usually do that by stopping the use for about 3 days. So first, there's smoking. Smoking involves the igniting of cannabis with a flame, i.e. using like a joint or a pre-roll or a cone or a pipe or bong, something like that. Now, it's easy, it's fast, kicks in instantaneous to 15 minutes, and is usually out of your system within 2 hours. Then there's oil vaping. Oil vaping involves the heating and vaporizing or actually atomizing the concentrated cannabis oil. Now, it's also easy, fast acting like smoking. It's also very convenient and pretty inconspicuous as well. Then there's dry vaping. Dry vaping involves the use of a dry herb vaporizer. You grind up the actual flower or the bud, place it into a dry herb vaporizer. Then you can set the temperature to what you want, because different terpenes, different cannabinoids come out at different temperatures. So you can actually get a different feeling depending on the temperature you set it at. They work very well, they are very smooth, they have the fast onset like smoking, but are way different. So when smoking or vaping cannabis, especially whenever you first start, I always tell people take 1 puff. Now, it's a small puff, in and out, not a high school puff, just a small puff. But then wait 20 minutes, because at 20 minutes is whenever it hits its peak. So then at that 20-minute mark, you're gonna know, was that enough? Was it too much? Do I need a little bit more? Those type of things. It's important to note that everything that is said that is bad about smoking cannabis has actually been inferred from smoking cigarettes, because we know smoking cigarettes are bad. We know they cause a lot of problems. But we don't smoke cannabis like cigarettes. And there are actually now several studies that show that smoking cannabis every day does not increase your risk of COPD or lung cancer. Then there are the tinctures. The tinctures are oil-based solutions. Those are the ones that go into your tongue, kind of like the CBD oils that are out and around. Now, depending on how high the dose of THC is how much of the tincture you want to take. So that can range from anywhere from several drops all the way up to a full milliliter or even more. Now, when you're using those, you put that under your tongue, hold it there for anywhere from 15 to 45 seconds, and then swallow what's left over. Those kick in within about 15 minutes to an hour, peak out about 2 hours. One of the good things about the tinctures is they are a little bit more readily available with those higher CBD values. They can come in 1-to-1s, 2-to-1s, 4-to-1s, 10-to-1s. So then remember, those higher CBD values, those higher CBD strains and products don't go to your head as much, but they really help calm down inflammation, calm down anxiety, calm down depression as well. Then there are the edibles. The edibles are anything you put in your mouth, swallow, and then digest. Some examples are gummies, cookies, brownies, Rice Krispie treats, ice cream, sodas, multiple different ways that edibles come. They even have ranch dressing. Edibles are easy, they're convenient, they do last longer in your system, but you have to be careful with edibles because they can take up to 2 or more hours to kick in. So you can get ahead of yourself really easily without realizing it until it's too late. Now, whenever you take in an edible with a delta-9 THC, that delta-9 is converted to delta-11 THC by your liver. Delta-11 THC is stronger, it's more psychoactive, and it's also more psychedelic, and also causes it to last longer in your system. So you have to be really careful when you're using edibles. We always say to respect the edible. You always want to start low and go slow. I usually tell people when you're starting to use edibles, start with 2.5 to 5 milligrams, then wait a full 2 to 4 hours before trying anything else. And then the most common dose of edibles is usually between 5 and 20 milligrams. Then there's the topicals or the transdermals. Those include the salves, the lotions, the rubs, the oils, etc. Those are applied directly to the skin. They work right where you put them, and they usually don't go to your head. They work really fast, and some people say they can last anywhere from an hour to all day. Then there are things like patches. The patches release a small amount of THC and or CBD into your system over a long period of time. They work really well as well. Cannabis can also be infused with multiple different things with almost endless possibilities. For example, bath bombs, bath salts, inhalers, suppositories, lubes, gum, lip balms, many things that cannabis can be infused with. Now, how do you decide what strain you want to use and where to find it? There's some apps for your phone, there's some things on your computer you can look up. PotBot, P-O-T-B-O-T. It's an app for your phone, it's completely medical, and it gives suggestions for strains based on your diagnoses, based on your symptoms, and what other people have used that help them with those same problems. Leafly is one of the largest databases of cannabis. It gives a lot of strain suggestions. It also talks about the different strains. You can look up the strains to see what they're going to do and how they might make you feel and what side effects you might have from them. Leafly also lists the dispensaries. It lists their menus, their prices, also has directions to them as well, and has a lot of good articles on cannabis. Weed Maps also lists dispensaries, has some articles on there, along with having those dispensaries menus and prices, turn-by-turn directions, contact, those type of things. So what's next? After your doctor visit and receiving your recommendation, then you apply for your state license. Now that application for your state license is done online via that state's portal. And then if anything comes up and you have any questions, concerns, comments, please don't hesitate to contact us. You can give us a call, email, use our website, thehighercareclinic.com, or on social media. So when filing for your state license in Oklahoma, you'll go to the OMMA website. Now, while you are on that website, that's where you'll find your application. There's also a 9-minute video on there that'll kind of guide you through the entire process step by step. Once you start working on that application, the most important thing there is to really follow those directions, because the state can't deny you a card because of any of your medical problems, but they can reject your application because of a typo, because something wrong with the application, something wrong with the picture. Now, if you do get a rejection, they're going to send you an email why they rejected you and how to fix it. And they give you plenty of time to fix that, re-upload it without trying to recharge you again. And I also want to make sure you pay attention to those passport style photos. Now you can take that photo with your phone without any problem. The problem is they really harp on that picture. So whenever you take it, really make sure you're facing forward, have a white or off-white background with no facial expression, no body adornment as well. Now the state fee for a 2-year card is $104.30 unless you have Medicare, Medicaid, Sooner Care, or a 100% disabled veteran. And at that point, it's $22.50. And that's for the 2-year card. Then once you get everything to the state actually has 14 business days to give you either an approval or a rejection for your application, and then up to 4 to 6 weeks to mail that to you. Now, it really doesn't normally take that long. It actually averages around 1 to 3 weeks for the entire process. Then once you get that medical card in the mail, you are able to possess and use and to cultivate cannabis legally. And then every 2 years, you'll need to renew that card in Oklahoma. So when filing your application in Missouri, you're going to go to the DHSS website. There's also a downloadable instruction guide. It'll guide you through on how to fill out that application as well. It's important to really follow those directions because, again, as in other states, Missouri can't deny you a card because of your medical problems, but they can reject your application because of a typo, because something wrong with the picture, something wrong with the application. Now, if they do that, they're going to send you an email why they rejected you and how to fix it. And they give you plenty of time to fix it without trying to recharge you again. Now, once you're approved for your card in Missouri, they're going to email that to you. So once you get that email, print that card off. You can laminate it. You can have it printed on hard plastic, but have it with you because having that card with you protects you if you are caught with any. Now, your card in Missouri will need to be renewed every year at a cost of $25 plus a service fee. Now, if you wish to cultivate your own cannabis in Missouri, you will need to purchase what's called a private cultivator's license. Now, by doing that, you'll have to fill out another little piece on that application and pay a $100 fee, and that's $100 a year for a private cultivator's license. And the DHSS will inspect your grow on approximately a yearly basis to make sure you're in compliance.